very good evening, distinguished guests, Dr. Fraternity, and a distinguished guest from the Tasley headquarters. This opportunity for me to share my beautiful clinical experience as well as the efficacy of DANSHEN Plus is a marvelous experience what I have personally had, and which I would prefer to share with you from a little bit of basic from the disease part, and then I go on to the real deeper aspect of our DANSHEN, including the clinical studies. So now when we go to the little bit of how many of us are prepared to face the future with mutation and diseases? How many of you all are ready? Okay, fine, let the disease come, I will face it. It's okay with me. How many of you all are ready with it? Not one of us. Everyone wants to be healthy. Everyone wants to lead a healthy life. This is what I also wished for it. But 1 year ago, there was a situation wherein I had a severe chest pain and I knew it was a block, 100%. I knew it was. Because while I was doing my morning jogging, I had that. But I knew the only solution was to get into DANSHEN. So I started off with DANSHEN, and today I can boldly tell you I run 5 kilometers every day now. No problem. I changed. It's 10 months now. I am on DANSHEN. So like that, clinically, I have been trying on a lot of patients. So of course, no one is ready for us. But most of us as doctors, what we all do is, most of the time we cling on with our knowledge of clinical practice and the tuning program, what our basic allopathy has been treating and telling us to do. But I would say just open up a little bit. It will really, really give a lot of guidance, not only for you, but for the patients. Ultimately, the patient gets the benefit, which is what we all need to look into. And I think with this beautiful session of today, you all will be looking into a deeper aspect of assisting your patients with this beautiful product and then probably enhancing their life quality as well. But other than that, I would definitely recommend you all should consume this particular DANSHEN definitely at least weekly, once or twice, definitely. It would be an added advantage for you. Now, how many of us are ready to... Most of us surrender to the disease, yes or no? The moment disease comes, what to do? It is my fate, and then I'm, of course, supposed to. And but here I would say, as doctors, we need to change a little bit of our perception towards the disease process and then perception towards the treatment module. Then things will be a little different. And many times it's too late for us to, realize that the disease is already set in. Like if you're looking at, because I'm in the preventive healthcare situation right now, this is where I'm able to tell at the cellular level, if you're going to get your blood pressure in the next probably 6 months to 1 year, now I can pick it up from the test. We can do that. We are talking about the metabolism at cellular level. Amazing, isn't it? In that way, here DANSHEN Plus and the microcirculation plays a very, very important role for us. Now, of course, going through the diseases, of course, it's the heart disease, the cancer, diabetes, hypertension, stroke, kidney disease, liver. We don't even know that the disease is coming in. How many of you are aware that the disease is walking into you? Because normally the disease doesn't knock the door of yours and tells, okay, fine, can I come in? No, right? Most of us, we won't even recognize that. For example, if you're talking about cancer cells, 1 centimeter of cancer tumor, if you take the number of cells inside, is 1 billion cells inside. It's just 1 centimeter. But how many of you all can recognize that just 1 centimeter tumor in our body? But already, how many number of cells are already involved is almost 1 billion. And if you're looking at 1 inch of a tumor, it's almost 1 trillion cells are involved in it. But our body consists of 75 trillions of cells in our body. So we still have the remaining 74 trillion cells to play a different role of augmenting your immune system and thereby protecting itself. So why not we assist our body? So we need to assist our body at the cellular level. Now, what are the main reasons? Of course, it's a very, very common sense and common knowledge that lack of blood supply is one of the reasons, right? If any of us are complaining of any pain in the body, what is the reason? Most of us, when we come to, the patient walks in, he comes with a pain, immediately we prescribe him a painkiller. It's a very simple concept we are doing. But why is the pain there? The pain is there. The only reason is there is some metabolic problem down there, which our main is the blood supply. If the blood supply is clear, then probably things will be a little more better. In that way, if our highways are clear, of course we can take even the fastest vehicle on the road and then move forward. So for a proper functioning of the cellular level, we are talking about a proper blood circulation, which is very, very important. Now, of course, lack of exercise, stressful food, lack of body, mind, soul, peace, all these are all additional situations for you. Like a pickle, these are all additional, which you have to augment with your regular whatever you are doing. So if you look at the graph down here, the hierarchy, if you look at when are we getting a disease, is of course the other end of our situation is a disease. Now, we as doctors, what do? We do give medications and go take back the persons to the pre-disease stage. We are not taking them to a healthy state. We are not. So what happens is, okay, at least if we can take into the disadaptation or to the adaptation level, probably the patient might be able to recover faster. Okay, now most of us know that we all, everywhere the blocking system has been there. Now if you look at the graph, of course it starts from the first decade itself. From the age 10 years, it starts. Our medical team has done a research on our youngsters, and they have told that in Malaysia there are 17 to 18% of the youngsters who are all getting blood pressure, that is hypertension. Are you all alarmed? Yes, it is alarming, but I would say for the past 1 to 2 years in my clinic when I'm practicing, I see a lot of Malays youngsters, Malay youngsters, their pressure is very high. They're just 20 years, 21 years, blood pressure, very high. So something which is alarming. Now what are we going to do for this? Now do you think the future generation needs to be an unhealthy atmosphere? No, we all need to. That's where we as doctors, we all can help our future generation to be more healthy. And in that way, of course, when it comes up to your decision of what to be given, what not to be given, I leave the choice to you. But here we are talking about Tasly, a company which has got all the credentials, which you saw previously. It has all the credentials what you're looking for. As an allopathy doctor, we look at FDA as the one which gives us a chop for us, saying that, okay, you can go for the medication. Of course, heart attack. Now, don't you think that IGN is fully packed? It's very packed. How many of you all have heard about microcirculation? As a medical fraternity in our MBBS, have we ever heard of a microcirculation? We had people, our professors talking about microcirculation. I frankly will accept that no. It was only 2006 when I landed up in Tasly, they were talking about microcirculation. I said, what is this microcirculation? I also didn't know. And they were using a microscope to check the... When I went and then did a research on this particular instrument, microcirculation instrument, it's an amazing information that China is the first country in the world to introduce this beautiful machine to the world. It's not Germany, it's not Russia, it's not US. I've already done more than 500 people. Personally, I have treated and I have documented it, saying that what exactly is the situation from day 1 to until 6 months. So it's an amazing experience I had in the previous 10 years with this beautiful company. Now, how many of you all know that it is called the second heart? The microcirculation is called the second heart. Because that's the end organ circulation. Now, if you imagine our blood vessels, if the vessels are clean and then able to pass on the blood down to the organs, is okay. But where is the nutritional exchange taking place? It's taking place at the micro level only. It's not at the bigger vessels. So bigger vessels is okay. We are talking about microcirculation. So this is another very important aspect for doctors especially. And when our the general manager from Tasly was talking about he wants the doctors to get involved. I believe that we all need to involve in it actively and then contribute to this society. Probably in the next 50 years down the line, we all can do a revamping with more of healthier generation we can create and then move forward. Now, if you're talking about microcirculation, of course it can be found in all the organs composed of arterioles, venules and capillaries. Can you believe the diameter of it? It's so small, we can't even see. But how many of you have seen the microcirculation under the microscope? How many of the doctors have seen? Beautiful. Isn't it beautiful to see our own circulation there, live with the blood flow going up and down? So beautiful, isn't it? And now when there is a block and then when you take DANSHEN capsule, in next 30 minutes you can see there's an improvement in the circulation. It does happen. Isn't that beautiful? So that means it's clinically tried, and then the efficacy of the whatever ingredients we are talking, isn't it beautiful? It should be a good asset for our medical profession because they have done all the clinical trials. Now, what is microcirculation? Of course, it's the end organ circulation where exchange of gases, exchange of nutrients, clearance of waste product takes place. And there is no other alternative. The last line, if you see, no other alternative system available for exchange of your whatever metabolism. It's only microcirculation. So here, Tasly is the company which is talking about microcirculation. Isn't that beautiful? We want the end organ to be sufficiently working with the proper metabolism, with proper exchange of gases, exchange of nutrients, and exchange of the waste products. That is what we are looking at. It's cellular level. So that's an amazing situation for us that we can complement. But if you're looking at our allopathic part of our journey, what is the medication we all have to put to our patients and then say, okay, fine, microcirculation will be improved? What is the medication we all have? How many of you all have seen this slide wherein the blood circulation? Can you switch? Now here you can see this one there. This particular plaque, it's a block there in the microcirculation, and after giving DANSHEN, what happens? It just clears up and moves off. Isn't that? This is a clinical evidence. What else do we want? You take DANSHEN and this is what happens. Isn't it beautiful? Now many of us were asking me, hey doc, if you take this and it goes and doesn't it go and lodge somewhere else, another block will happen? No. Our body is so beautiful that it will actually dissolve it and throw it out. Our body is amazing. The God's creation, we are all having a greater. But one thing we all should understand, that individual human being, the way we all work is different. No doubt we all have the same organ, same, but ultimately the function, the way we all receive the metabolic situations are different. One medicine you give to 10 different people, it acts a little differently. So here what happens is little further step for us to assist our patient. My goal is, I want to help this person. Can I do it? So in that way, the moment we put on this particular medication, definitely they can see some fantastic improvement. Okay, now if you are looking at the number one killer disease in today's world is of course coronary heart disease, because that's the main junction where something goes wrong, everything goes wrong. So we are looking at, everybody is looking at wants a healthy heart. So if you want a healthy heart, definitely you should be consuming DANSHEN so that keep your heart healthy. Don't wait for the situation to occur and then you want to change. It's too late actually. Now this is a comparative studies. Now there is something you all can see something little different in the slide. What is that you are looking at, the difference between United States or Malaysia and China? There is some category which is different there. What is that? Yes, you see there is number one in the two here, but in China it's the third. Why should it be? So that means those guys are actually already taking DANSHEN indirectly through different forms already there. So that's good actually. If your cardiac is healthy, good enough, right? Now this is our latest, yesterday I picked it up on our latest Malaysian health, this one. If you look at our, this one is number one is of course coronary heart disease. Okay, now I'm basically going down to the DANSHEN, and of course it's a traditional Chinese medicine product from China. Most of us, we are all scared, the moment they say it's a product is from China, we are all really, taken aback. But I would personally say that after I went and saw the Tianjin province, their manufacturing unit, I would say even in Germany or even in US, the quality of the preparation, their etiquette, their way of handling things has been far, far ahead of, I would say, even US. Their professional handling of each of our dripping pill, whatever their production there is very high standard. That's good enough. That's what we are looking at actually. We as allopathy doctors, of course, we are looking at a very high quality, high standard, and the product efficacy has to be clinically proven. That's what we all look at. And then this particular product has been gone through all the basic necessary for our allopathic practice to be prescribed. It's not a problem at all. Of course, the company had an opportunity to do the clinical trials in US, and then of course we all know that the clinical trials go with phase 1, phase 2 and phase 3. And phase 3 is basically we are talking about giving it to the patient practically and then seeing recording the results. And in my understanding, what I believe is if I'm going to give Danshen Plus for 1,000 patients, what's happening to my 990 patients, what's the results? The remaining 10, if there is some adverse effects and this one, it's still okay. Then it's passed by the FDA and say, okay, fine, you can prescribe the medicine through the pharmacy. That's what our FDA does. So what we have in Tasly they have done is they have already finished their clinical phase. Now if you're looking at, is it that only in US they did this particular study? Yes, of course, because everybody wants to get an FDA approval first, and so it becomes a very easy, because it's fascinating for us if it's FDA approved. But actually speaking, they have already done research in Germany and a lot of European countries. In Japan they have done, Taiwan, Korea, they have already done a clinical trials by giving it to the patient in the emergency wherein patient comes with a chest pain. They have given the medication and found that it's an amazing way of helping the patient to, even if a patient gets a heart attack, is not a problem. You give at least 6 capsules, 1 shot is no problem at all. In that particular situation, I still can remember one of my patient, he was admitted in the hospital there, and then he was supposed to go for a bypass on Wednesday morning. Monday morning, he got admitted with chest pain, and his wife called me on at around 10 o'clock in the morning and asked me, Doc, he doesn't want to go for an operation. Can you assist us? Can you assist? I said, I'm taking, what do you mean, assist? I said, no, sorry, I can't assist you because he's already there in the hospital, and day after tomorrow, they already decided to go for an emergency bypass. But they said, no, doctor, my husband doesn't want. Can you really... Then I told them, I cannot take a risk, but I can assist you in this situation so that you take the risk. I'm not going to take the risk. They said, okay, doctor, no problem. And that's when they came immediately at around 11 o'clock. They came, Danshen, they picked up. So I put him on 2 capsules, 2 in the morning, 2 in the afternoon, 2 at night time around 8 o'clock. Only 6 capsules. And immediately this guy felt a little bit of relief by night 10 o'clock. The next day morning he got up, he was feeling very free. So what he told the cardiothoracic surgeon was, doctor, can I get 1 week of my time so that I will go decide whether to go for a bypass or not? He just requested the doctor, and incidentally the doctor was very polite and then said, he said, okay, but you're, of course he had to put against medical advice signature, and he walked out. He came out of the hospital, and this happened in 2009, and today is 2015. His 6th block is cleared. He's healthy. He didn't go for a bypass. He was my amazing testimony. This is amazing, actually. And there was another very beautiful situation where a diabetic, this girl is a juvenile diabetic, and her vision was actually totally gone. She couldn't see anything. One eye only, probably with a little bit of blurring. So I started her on Danshen, and exactly after 3 months, suddenly one morning she called up and said, hey, doc, now I can see clearly. It's after 6 months. So there was some benefit she got after consuming Danshen. So that's another beautiful. Another case was the doctor was decided to amputate the leg. And I said, why not, you wait. And she was supposed to get amputated at around 12 o'clock afternoon. And they called me at around 10 o'clock. I said, you wait there, I'm coming to the hospital. I went to the hospital and I said, this looks okay, because I felt that only blood supply is lacking. If I can give something, then, and they were also cooperating with me. So I put her on 3 capsules just to start off. Anyway, if at all it doesn't work, they're going to amputate the leg. It's still okay. What? I started with 3 capsules. 3 times daily. I don't know, I really took a big risk and then put 3 capsules. And you won't believe, after exactly 1 week, the surgeon is coming, what is that happening? I think God is really great. He came and healed. Your leg looks normal. You don't need an amputation. And she didn't go for an amputation. And as of today, they are consuming still, it's almost 4 years, they are still consuming the Danshen. So there, if you look at, is more of personal desire to heal. As initially the doctor said, Oslers, we should have the desire to heal. It's not to treat. Treating is different. Healing is different. Treating is, of course, they have a problem, you prescribe and you treat the patient. But healing is something beyond. You work at your soul level. Tasly has done all the research and all the necessity documentation, and the money they have spent is quite a bit. Our job is to go into it, get the details, and if you are satisfied with it, then start prescribing. It's okay. It's beautiful. And for us, we are always in a situation where is it approved by FDA, then only we will prescribe. Yes, of course, that is a very important tool. As long as the clinical trials are there, we don't have to worry. Now we are already in the clinical phase 3, so it should be easy for us to move forward. Definitely it reduces the platelet aggregation. If you look into your clinical practice, if you can consume DANSHEN regularly, your cholesterol comes down. It's another amazing tool. So most of my clinical practice, what I do, if the patient is on any blood thinners, after 15 days to 3 weeks, I reduce the blood thinner, and then once DANSHEN is inside, that's good enough. After 1 month, we can actually take it out. Unless they are with IGN and then they are on the blood thinners, there we need to monitor them personally, and then I would say that needs a little bit of clinical assessment, and then we decide what to do. But most of the time I have taken out aspirin in most of my clinical practice, and then they are fine, absolutely, because DANSHEN does the microcirculation increase. Number 2, it can reduce your cholesterol. What else you want? Number 3, it can thin your blood. Good enough. Then the vascular stability, you mean the vascular wall stability is done by DANSHEN. Good enough or not? It's amazing. That's what we are all looking at. So all the 4 function for a vessel, when this particular product can do, why not? And most of the time, if I'm looking at cholesterol to be reduced, the first thing is exercise. The second thing is, of course, I might see the situation and prescribe DANSHEN. You can see the difference before taking the DANSHEN plus, the ECG changes there, and after that, post ECG. Don't you think it's clinically proven? What else do we want? It is proven that once you take DANSHEN, it does help the improve. Ultimately, what nitroglycerin does is the same thing. It improves the blood circulation. Okay, we see the control study there. On the center, you can see a damaged vessel, coronary artery there. And then the same, when the patient is given with DANSHEN, what happens? Don't you think? These are all micro level, histological. Beautiful, isn't it? This is another amazing proof we all have that it works at the microcellular level. Now this one, retinal microcirculation, can you believe? Of course, if you see the center one, of course it's clogged. The cells are all clogged. But the normal one is beautiful. After DANSHEN, it's so beautiful. What proof you want? These are all actually micro level, they are able to pick it up through the microscope and they are able to show you. What else do you want? This is in the kidneys. Now most of us with diabetes and all, we are having a lot of problems with our kidneys. Of course, see here, the moment you put DANSHEN, what happens is you can see it becomes more or less near normal. If each glomerulus can become near normal, of course the urinary renal function is going to improve. So of course, if you are looking at the safety profile is per day we can go up to even 10 capsules is not a big deal. You should be able to, the tolerance level is good enough. And if you are a diabetic, I would definitely recommend go for DANSHEN. If you're having a stroke patient, definitely DANSHEN. I would always recommend go with DANSHEN a little bit, because nowadays the cholesterol level is quite high with our people. So what I advise is, when you can add DANSHEN with your regular routine, things are much more easier for them so that they can live a little more healthier lifestyle. DANSHEN has been there for 21 years. Isn't it sufficient enough for us to understand that this product is good enough for us to prescribe to our patients? Why not? 21 years is not easy. How many drugs can be there for 21 years in the market? This is there for 21 years. And of course, they have upgraded the thumbprint technology he was talking. The dripping pill technology is an amazing technology. I just wish to share here, what is this dripping technology is? If you're taking the first drop of that particular, it's like a mustard seed, right? The DANSHEN pill. Now the first one, they take it and then they analyze what are the ingredients inside, all that they will check. Okay, they will put X, Y, Z is there in the dripping pill number 1. Now when they do for the 1000th dripping pill, what you saw in the number 1 is there in 1000 also. That means they're standardized. Isn't it good? That is a beautiful technology which China has got. So that means there is no hanky-panky things there. There is no hanky-panky. Is there, that's it. So don't you think it's an amazing? That means if you're consuming the 30 capsules bottle, all the one granule. You know how many granules are there in each capsule? Approximately between 18 to 21. Approximately. Now each the granule, if you can pick it up, 100% you can go and test it. It will be the same. So that's the technology what our Tasly has. So it's an amazing dripping technology what they have brought down. What I would say is this particular DANSHEN is not just for the heart. I would say it's for the whole body, right from your head to toe. Go for it. It's an amazing supplement for us. Okay, DANSHEN Plus is very effective, safe for the treatment of stable angina induced by coronary heart disease. Now, as a medical fraternity with the allopathic foundation, we can assist our patient. This is what I look at. A brief information about DANSHEN and its benefits and its efficacy. And thank you all very much for your patience hearing. And then I believe that you all enjoyed this, this sharing of DANSHEN with you all. Thank you very much.